Good morning, everybody. I'll just tell everyone, MC Dalton Benson, Acting Planning Section Chief. Welcome to the Anchorage Emergency Operations Center update for March 25th, 2021. All right, once again, a reminder to drive the decline, wear your masks, get your vaccines. So we'll start out with the situation overview.
This is John Cecil, Information Management Specialist. It's day 386 of the incident, starting with the cases. For Alaska, 59,383 cases, an increase of 738, 308 deaths, an increase of 2, and 1,336,000 hospitalizations, an increase of 23. For Anchorage, 27,442 cases, an increase of 341, 164 deaths, an increase of 1, and 733 hospitalizations, an increase of 4. 213 resource requests filled and satisfied, 1,713, an increase of 6. Open and working, 17, and staffing, 5. For non-critical transports, there were 42 over the last 24 hours, and there were 2 after hours. For sheltering, Sullivan Congregate, 377 clients, a decrease of 9. Fairview Congregate, 41 clients, a decrease of 8. Covenant House Congregate, 7 clients, an increase of 1. For the non-congregate sites, quarantine and isolation, 58 clients, a decrease of 11. Site 1, 19 clients, a decrease of 2. Site 2, 22 clients, a decrease of 2. Site 3, 158, an increase of 3. And Site 4, 87 clients, remains the same. So total congregate, 425 clients, a decrease of 16. Total non-congregate, 344 clients, a decrease of 12. Total for all shelters, 769 clients, a decrease of 28, with an average of 2,307 meals served per day. For testing, as of March 24, there were 894 sample collections, averaging 81 per hour. And unfortunately, we don't have any numbers for the vaccines today. They're temporarily unavailable. End of report.
National Weather Service.
Good morning. This is Michael Cutts with the National Weather Service in Sand Lake. Basically looking at our snow tapering off very slowly through the rest of the day into the early morning hours tomorrow morning. Since the front has passed us, just a little bit of moisture getting wrung out of the atmosphere, as it were. We may see some snow pellets or sleet mixed in with it, but generally a wet snowfall through the remainder of the day today. Short break over the weekend, but the snow returns for the beginning of next week.
Thank you, National Weather Service. Everyone drive safe out there. Operations.
Good morning, everybody. This is Rick Meredith, Operations Section Chief. In our mass care branch, Q&I has 7 projected discharges through Saturday and 1 today. Our warming tent had 90 people in the last 24 hours. We can probably kind of tie that into a lot of the decrease in our congregate and non-congregate and having some of our clients utilize the tents instead of doing that. Our public health branch, we had another decrease in our testing. That, of course, with the testing positivity rate tends to drive it up a little bit higher. So what we're trying to do is keep encouraging testing while we still have vaccinations going on. It's still a part of our program to help defeat COVID in the community. The 14-day averaged reproductive rate is 1.063, and we'd like to try and keep that down below 1. So remind everybody, keep going out and testing. Our pop-up testing sites are as follows. On the 25th, which is today at Wendy Williamson parking lot. On the 26th, New Nuka Valley. On the 27th at Willow Crest Elementary. And on the 28th at Wonder Park Elementary. In our medical countermeasures, the Hotel Captain Cook vaccination event is going on this weekend. It's with Pfizer. No appointments necessary, but appointments are available. There's limited free parking in the Diamond parking site in K Street Garage. Visit Healthcare has sites located at Shiloh Baptist Church, as well as mobile vaccine teams all over. And our EOC Mobile Vaccine Task Force will be wrapping up APD vaccinations and offering other workplace vaccination clinics to critical infrastructure workers. What I will remind everybody right now, when I looked on the appointment sheet, there are over 2,000 open appointments available right now. So encourage everyone you know who needs a vaccination, because Alaska is one of the few states where it's open to everybody to go out and get vaccinated, utilize that, and take the offensive on COVID. That concludes my brief.
Thank you, Operation Logistics.
Good morning. This is Scott Carpenter. I'm the Logistics Section Chief. On our slide here, you'll see the significant prioritized types of support we're providing currently. For mass care support, we're handling a bunch of personnel requests and onboarding those personnel as we receive them. We have a couple of consultation type requests in the queue that we're currently working for them as well. For medical countermeasures, we continue to support through finding indoor, drive-through, and mobile team sites for the medical countermeasures folks. For the EOC, we're primarily working on staffing requests for additional EOC personnel. And as we've mentioned in previous meetings, we no longer have a PPE warehouse. So you'll continue to send your PPE requests to the information below, and we will assist with getting those fulfilled by the state. That concludes my briefing.
Thank you, Logistics. Finance.
Good morning. This is Carrie Wiedeker, Finance Section Chief reporting. Currently, the EOC has encumbered $21,111,369. Our actual spent to date is $42,669,069 for a total of $63,780,439. Please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management continues to seek cost recovery through FEMA public assistance. If you have questions about that, please contact Erin Zachary at anchorageak.gov and report.
Thank you, Finance. Safety.
Good morning, everyone. This is Municipal Safety Officer Aaron Carter. I'm filling in for the City Safety Manager, Annalisa Roberts. In light of recent tragic events in Boulder, Colorado, I'd like to present a brief overview regarding the situational awareness color code chart. If you noticed, white, yellow, orange, and red are the various states. White is the lowest level. You're completely switched off and unaware of what's going on around you, not really ready for anything due to various reasons. Yellow is a good level of situational awareness. You are alert and aware, but also calm and relaxed. You're not paranoid. And in this state, it's difficult for anyone to surprise you. Orange is a heightened level of awareness. You sense something is not quite right, and now is the time to evaluate and formulate a plan. And red is when you are taking decisive and immediate action. These states of situational awareness can be applied to not just emergency situations, but everyday life, such as driving or using your cell phone.
Thank you, Safety. PIO.
Hey, good morning, everybody. This is Kel Casey, Lead Information Officer for the Emergency Operations Center. What you're seeing is a list of our key action items for today, and we do coordinate very closely with the Mayor's Office, Public Information Officer, as well as Anchorage Health Department and all the municipal communicators. We are definitely focused on the importance of testing and have been working also on a sports team testing education campaign in coordination with the Public Health Branch Director. We are also working with Northwest Strategies to research and focus ads to our underserved non-English speaking populations to their smart devices, especially in the younger age group. They have a larger social media group and they can influence that group when they get vaccinated. And at the state level, they've been encouraging that with TikTok dances and things like that. We're hoping to do the same with this campaign. We're going to continue to promote the Hotel Captain Cook appointment-less clinics on Saturday and Sunday. We're following up with the media requests, and we're prepared to escort local media as interest in these appointment-less clinics is high. We continue to promote the Shiloh Baptist Vaccine Clinic, and we continue our outreach strategy that serves our multi-generation and vaccine-hesitant populations. We have a daily email blast that goes out that has all the vaccine appointments, key messages, talking points, graphics, flyers that our influencers and peer leader navigators can get out within the community. And we are also bringing on a new social media public information officer, Laura Atwood, who was formerly with Animal Control.
All right. Thank you, PIO. Liaison.
Good morning. This is Celeste Prescott. I'm the liaison for the Emergency Operations Center. I'd like to thank all of our partners that were able to join us today. I know some of our usual participants are on and available for questions, but they do not have anything to report out today. Do I have any other cooperators on that would like to report out at this time? So hearing nothing, we'll move on to our hospitals.
Good morning, this is Kirsten Kolb with ANMC. Today at ANMC, we have 1 positive, 0 PUIs. That 1 positive is in the CCU and no ventilators in use. End of report.
Thank you very much, Kirsten. And do I have anyone on for Alaska Regional Medical Center?
Alaska Regional Hospital currently has 4 positive COVID patients. All 4 of them are still in isolation. We have 3 PUI, no ICU, no vents.
All right, thank you so much, Sean. And is Michael or anyone else on for Providence Alaska Medical Center?
Yes, this is Michael. We have 8 positives today, 1 in ICU, nobody on ventilation, and 10 patients that have recovered.
All right, thank you very much, Michael. And do we have anyone on for the 673rd Medical Group?
Good morning, ma'am. Captain Arbach here. No significant updates for the group.
Thank you so much, Captain. That will conclude all for the liaison. Thank you.
Thank you, liaison. I will move to the incident command.
Good morning. This is Bob Dole, Incident Commander. I had an opportunity with the mayor and the health department director to go out and see the Jaybear point of dispensing yesterday. I think what Captain Arbach isn't sharing with us is they have a very smooth and effective and efficient operation there, which I think is really important to that they're in the fight and working with that population. Want to extend my compliments to the team out at Jaybear on the team. Thank you. We started this briefing off with talking about driving the decline in numbers. In order to avoid an overlapping response and recovery phase, we need to get out of response. And frankly, if we look at the numbers both nationally and locally, we're no longer declining in new cases. It's flat or maybe a slight increase as it's going. Everyone here is doing everything they can to stop that. We greatly appreciate it, but I want to reiterate the offer from the EOC. We'll work with anyone in any way possible to continue more aggressively driving that decline in cases through increased public information, increased vaccines, increased testing, taking care of our vulnerable and mass care, or anything else we can do. We thank you for all you're doing. And if you have a new idea or a new initiative, don't hesitate to contact us. End of report from Incident Command.
Thank you, IC. The next operational update will be next Tuesday, March 30th, since Monday is Seward's Day. Thank you, everybody.